I've been performing total ankle replacements for the last 12 to 14 years. The advantages of total ankle overfusion, in my mind, is A, maintaining motion, so you unload or you don't put stress on other joints around the ankle joint. So maintaining motion for their gait, for preserving other joints, and pain control. The goal is to get rid of their pain. My dad's involvement of the agility ankle was back in the mid-'80s. He designed and invented the Depew agility ankle replacement. He was drawing out diagrams on napkins around the house, trying to figure out a way to design an ankle that would work. Prior to that, the ankle replacements were failing so bad that the pendulum had gone back towards fusions. My experience with Infinity over this past year since the pre-trial launch has actually been very good. I've been happy with the instrumentation. I've been happy with the stability of the ankle when it's in place initially. And more importantly, I've been really happy with the patient satisfactions early on.
What we have now with the Infinity is we can use a system called Prophecy, where we get a CT scan of the patient, they make a model of the ankle, and then that shows you exactly where to put the cutting guides. So it takes the guesswork out of the operation and makes it very simplified.
Prophecy benefits me as a surgeon because it really saves OR time. If you can knock off time and still get more precise cuts, that to me is what's important. I have to admit that I was really a naysayer when I heard about this. But I've started doing it and have just been really impressed with how accurate the alignment is every time. And so it's been an eye-opener to me, and now I do it every time, if I can. Also, as important is the saving radiation, X-ray. You use a lot more fluoroscopy when you're trying to align the ankle with alignment jigs. When you just put the cutting jig in place and pin it there, check it under fluoro to make sure it's not off, it saves OR time and radiation.
The learning curve when we started using the Prophecy CT was virtually nil. I could put this guide in, get 1 or 2 views on my C-arm to recognize the alignment, and then proceed with making the bony cuts right away, instead of fiddling with guides for about 15 minutes. So the current ankles I use are the Right Medical Infinity and the M-Bone. The M-Bone I use for typically revisions because I can get that vertical fixation into the tibia. The Infinity I use on most of my patients.
My takeaways from Right Medical is it appears that they have put their money where their mouth is. They have been really investing time, energy, money, finances, and surgeons to try to make a better product. And in the end, I think that that's going to win.
There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.